Hi everyone, good day. So we're back for Living and Listening podcast today, and we have a special guest today. We'll be talking about anything related to hepatitis, Sempena World Hepatitis Day. So yeah.
Hi, I'm Dr. Hema Hariraja. I'm the consultant radiologist at GHHS.
Okay, so Doctor, for today's podcast, I'll ask you a few questions and we'll follow up on how it's going to be.
Okay.
So the first question is going to be, could you generally explain what is hepatitis and why do we have a World Hepatitis Day? Why do people need to be aware of hepatitis?
So hepatitis essentially means inflammation of the liver. There are several causes for hepatitis, the most common being viral or non-viral. The viral hepatitis includes a few different types. There's hepatitis A, B, C, D, and E. Non-viral hepatitis can be caused from autoimmune disease, medication, alcohol consumption, or toxins. So the thing with hepatitis is it's fairly common and it can be silent. Not many people even know that they have it, and that's why it's very important to be something to be aware of.
Is there any symptoms that we can see or we can observe ourselves that we are having any hepatitis issues or problem?
And yes, there might be in some cases, and that would be symptoms usually more progressive into the disease, and that's when the hepatitis starts to cause chronic liver disease or liver cancer.
I've heard that hepatitis B and C are more common and more dangerous, and why is that?
Okay, the reason the different types of hepatitis B and C are the ones that are considered more dangerous because these are the ones that can cause chronic liver disease such as liver cirrhosis and liver cancer as compared to the other types of hepatitis.
Oh, and how does ultrasound can help this liver problem?
Ultrasound is a very good method to assess the general health of your liver. It is non-invasive, it is quick, it is fairly easy to do and only requires 4 to 6 hours of fasting prior to doing the scan. Ultrasound can give you a lot of information about the general health of your liver. It can tell you if you have any signs of liver disease and any signs of liver cancer, or even the most commonly seen liver problem, which is fatty liver.
What is the process of ultrasound? Like, what do people need to go through, and what is the before step and after, during and after?
So ultrasound is very, very easy, uncomplicated scan. All you need to do is fast, do not consume any food 4 to 6 hours prior to doing the scan. You can drink water, plain water is fine. And the scan can be done in less than 10 minutes.
And then do I need to lie down or?
Oh yes, so you just need to lie down, that's all. And then the person performing the scan will put a probe on top of your abdomen to take a look at your liver.
So basically it will look through our liver and then we'll identify what kind of liver we're having, or hepatitis or
Yes.
fatty liver.
Yes.
How does hepatitis be identified?
There are several ways to see it. Sometimes in some patients having acute hepatitis, I may be able to see changes on the liver, the appearance of the liver. But more than that, for hepatitis B and C, I'm looking more for signs of chronic liver changes and liver cancer predominantly.
What kind of people usually are suitable to come here for liver checkup or ultrasound?
I think it's recommended that every adult get their liver checked at some point.
Start from what age?
Adult, I would say from 18 and above. It would be good to get a liver scan done because some conditions such as fatty liver nowadays are detected very, very early, even in those under the age of 20. So all adults, I recommend all adults get an ultrasound of the liver at some point. And those who are hepatitis B or C carriers should consider getting it routinely done every year.
Can you briefly explain the differences between A, B, C, D?
So hepatitis A and E are the ones that are transmitted via contaminated food or water, and these generally, once you have them and you're treated, they can revert completely back to normal. So it does not carry the risk of chronic liver disease or liver cancer such as hepatitis B and C. Hepatitis B and C has got this risk. So if you have it, then you're always going to be at risk of having chronic liver disease and liver cancer.
Because I see that, for example, in our center that we're giving away, we can give them checkup for hepatitis B and C.
Yes.
But then if A, we need to go from external. Why is that?
I believe it's done via blood test results. So I'm not quite sure which test results are.
Okay, it's okay. Because from what I understand, B and C can get on the same day, but
Yes.
A might take longer. But
I
then you said A and E is like
Yes.
lower risk,
Yes.
but then B and
It's
C
not
is
as concerning as B and C, because B and C are the ones that carry that long-term risk. It's a long-term risk of chronic liver disease. And chronic liver disease, once you have it, it's irreversible. So
It's
will not-
irreversible.
Yes, once it's chronic liver disease, it's irreversible. We cannot bring the liver back to what it was before. So that's why we want to detect it early, and we want to give treatment early.
When you say it's irreversible, what are the precautions that people can take to avoid themselves from having those kind of things?
One is to get yourselves checked and to see whether you are a carrier of hepatitis, any sort of hepatitis infections. Ultrasound, and to do ultrasounds as frequently as possible. And of course, those who are at higher risk, such as those with medical conditions such as diabetes, hypertension, those who are obese, those who regularly consume alcohol in excess, they would definitely benefit from this. Sorry, I can't give you much information about the treatment because I'm not involved with treatment.
Yes, you're involved more in radiology.
Yeah, I'm more diagnosis.
Yes, I understood. Okay. When you say it's irreversible, what is the early stage, and how do you identify if it's early stage, or how do you identify it's too late to reverse?
Okay, so there are a few different modalities that we use to assess your liver to see if you have liver disease and how bad your liver disease is, and that would include the blood test and the ultrasound. So we use it both together, and then we come up with a diagnosis. So from the ultrasound part of it, I can see how much the liver has been affected just by the visual aspects of the ultrasound itself, and by looking at the liver and assessing the liver as a whole. And that can tell me which stage you're at in terms of your liver health and your liver function.
How would you describe a healthy liver, or what's the difference between healthy liver and then fatty liver and then chronic disease with liver?
So these changes are very easily seen on the ultrasound, and we can usually tell them all apart. But generally speaking, a fatty liver will be a liver that's swollen with fat, and a chronically diseased liver becomes shrunken. Very much shrunken. And once it has reached a shrunken state, generally it will not go back to normal. It cannot go back to normal.
But if fatty liver, the swollen one, it can...
Yes, it can. So fatty liver, which is normally the first stage of liver disease, it can be reduced with lifestyle changes, with supplements. We can reduce the fat to completely normal. It is still reversible normally at that point.
But then if it's shrunk, no turning back.
No, once the liver is shrunken, there's usually no going back from that.
That's why it's better for you to do ultrasound now.
Yes.
And check it now before it's too late.
Yes.
So if you, for example, the most common one is people have fatty liver.
Yes.
So fatty liver, all you need to do is change your lifestyle, your whatever you're taking, and
cholesterol. Controlling cholesterol.
Cholesterol is also affected by our liver juga.
It is. It is a factor for fatty liver, and cholesterol control is also very important.
Which is very hard for Malaysian because we eat a lot of high cholesterol foods.
That is true. That is true.
Well, what is the common cases that you have been seeing throughout the years you've been in with GCHS?
Most common, and I see this younger and younger each year, is fatty liver. I have scanned teenagers with fatty liver, and fatty liver is the first step. It's the first step to chronic liver disease. It starts off with fatty liver. We don't do anything about it, and we allow it to progress. Eventually, it becomes chronic liver disease, and then it becomes very difficult to reverse. So it's happening younger and younger now. So especially it's definitely a concern.
Especially because whatever we consume now is a lot more cholesterol and everything.
Yes, compared to perhaps 20, 30 years ago.
What is the main function of our liver, and how does it changes? For example, if a person have fatty liver or a person have chronic liver disease, what is the difference between their lifestyle, or what is the difference between how do they the main function of liver, like for a healthy person, and then for a person with fatty liver, and then for a person with chronic disease of liver.
So the thing with the liver is it is an essential organ. Without a normal functioning liver, you will not be able to live. So the liver has got multiple functions. It functions on so many levels in terms of, I could get into that now, but there's just too many functions to the liver, but it's all essential functions in terms of
Yang
your
paling
life.
common, the most
It has to do with basically breaking down all your toxins, all the filtering system, I suppose, for your blood. Yeah, it's something like that.
So it's filtering
in simplified terms.
Yeah.
Because it's very, very complicated in terms of so many things that the liver does.
For people to understand how it works.
It
why it's
works
important.
in all these manners. And so liver function is one that is affected by so many different things. And it's also affected by just getting older. Fatty liver, of course, the first thing that seems to affect the liver and its function. Hepatitis is also another common factor that affects the function of the liver. And if this liver function, which we assess from blood tests, normally from the blood test result and the ultrasound, if it's not addressed, if it's not treated, if it's not fixed, progressively over time, that's when the function of the liver starts to be affected, and then it starts to reduce and to the point where the liver does not do what it's supposed to do anymore. And then it affects your life in multiple ways. There are so many things that are affected by a non-functioning liver, eventually resulting in death.
And we don't even realize it happening towards us because it's inside us, and slowly we didn't realize.
It's slow. It's a slow process. It does not happen fast. It does not happen over 1-2 years. It takes many years.
But then suddenly you will know that you can't move, you can't do this and that because your liver has been shrunk.
Yes.
So it's better to take precautions from
Yes, blood tests, ultrasound. These are the best ways because it can show even minute, small changes that are happening in your liver way before you can physically feel anything.
Do we have vaccination for?
Yes, there is.
Oh,
For hepatitis.
What kind of vaccination do we have for hepatitis?
There is vaccinations for hepatitis B and C, I believe, and A and B. There's vaccinations for hepatitis A and B, but and these are quite routinely done and available in most centers.
How frequent do we need?
I think it's 2 doses, but I'm not sure how often it needs to be done.
Okay, but it's 2 doses.
Yes, but there is a role. So in terms of educating yourself and sort of monitoring yourself for signs of hepatitis, some of the best ways to do it would be via vaccination, lifestyle changes. Try to maintain healthy lifestyle, reduce alcohol consumption, fatty food consumption, doing early detection and regular checkups, regular consistent checkups. Every year would be
Once a year.
Ideal, yes.
Okay, understood. Okay, so everyone, due to World Hepatitis Day, we're giving out free hepatitis B and C at our GHHS, and including in the package, we also have ultrasound for upper abdomen. Liver is upper abdomen, right? Yeah, you have ultrasound for upper abdomen and liver check, your liver profile check. So if you're interested to know more about your liver health, and check whether you have hepatitis, all you need to do is DM us, and we'll get back to you, and you can check your liver health with us by today.
Thank you.
Thank you, Doctor. Thank you, Doctor, for today, for spending time with us today.
You're most welcome.
Okay, thank you. Bye-bye.
Bye.